And welcome, everybody, to COVID by the Numbers. I'm Steve Irvin, filling in for Katie Ramel today, joined as always by our data guru, Garrett Archer, from home, running down some of the numbers on where we are and where we stand on coronavirus today. Of course, we always welcome your comments and questions. You can submit them here. We'll try to get some of your questions answered as well and try to identify the trends, particularly in your area and your zip code. We're going to start, though, with the summary and the numbers as they stand today. And Garrett, I guess a little cause for concern now that we're seeing in the last couple of days in terms of what could be a trend upward or could just be sort of hitting the bottom, I guess, right?
Yes, I have the summary page pulled up, and you're exactly right, Steve. We're getting to the point where the moving averages are no longer moving downwards. They're now moving in an upwards direction. Very, very little bit of movement, but still, it's definitely changed directions. So first things first, number of new cases today. It's been 21 days since I've said this, over 1,091 cases today. We have not had that for 21 days. We've been under that. And as people are saying in the comments, it definitely has a tremendous amount to do with ASU. And we will get to that in just a moment. The number of deaths, 5,130, 65 reported today, but those 65, as has been customary from the last couple of weeks, it's all from certificate surveillance. A lot of deaths coming in from August, July. It's them going through the data and making sure that everything gets properly added. 9,000 tests about today for the PCR, and I'm just getting the percent positives. The percent positive was rather high today if you're just using the COVID tracking numbers, which is 12.3 was the percent positive when you look at those tests to cases. However, when you look at the actual sort of the electronic reporting tests of the last 7 days, the number's still pretty okay. It's definitely still under 5%. So as far as how the numbers are coming in the electronically reported numbers, everything still looks okay there.
So when we talk about either bottoming out or trending up, this is a trend that you say it's changed direction, but it's something we've only noticed really in the last few days, right?
Yes, and I'll pull up the sheet that shows that in just one moment. I just have to pull it up really quick, and then I'll show you what I'm talking about. It's basically the actual date of the Epicurves when the cases are coming in, and you will definitely see with the moving average that it has changed directions is the best way of putting it. So just a few more seconds as it renders, and then we're good to go.
And so when you say it's changed directions, that only means it's not going down, but it's really too soon to say whether we're starting to see things go back up.
Absolutely. And you're exactly right. So I've got it shared, and I'll show you what I mean here. This is the Epicurve, the actual date of collection. And this yellow line here represents the 7-day moving average of all of these days. And as you can see, we've been on a pretty fair descent ever since early July. But now you see that the moving average is now detecting an upward motion. It's not an aggressive upward motion at this point, but the slope has now changed directions. It's now no longer going down. It is now going up. And that is today pretty much the first time that is detectable. You can see in the test, we've been sort of on this flat line with tests for quite some time. Let's see, with deaths, just so I'm going through all of them. Here's the deaths, and you can see this is what I'm talking about with the certificate surveillance. You can see that all of these are coming. There are deaths coming in from even as early as June in some cases, and then most of them are coming in. Most of them are coming in late August, where you would expect them, but a good percentage are coming in from July and August.
Hospitalizations, I want to talk about that because that's often one of the indicators that we see almost immediately is how many people are in the hospital right now. And correct me if I'm wrong, but hospitalizations sometimes give you the first indication that you're starting to see a spike before you see it in some of the reports of deaths and percent positives and that sort of thing.
They can, and this is why this is where we sort of get to the explanation as to why, right now at this very second, ASU is driving the the increase that we've been seeing because we haven't really seen much change in the hospitalizations. I have it pulled up and I'll share it with you really quick. We're at floors pretty much everywhere. So this is our inpatient number. You can see it's down slightly from yesterday, but we've been at a floor since about late August. We broke under 700 and we've remained under 700 since. Ventilator use, I think I've seen stories and read stories about ventilators. The doctors choosing to no longer use ventilators when they don't have to, because as you can see right now, 135 ventilators, that's the second lowest. And that's counting this April 8th, which is likely a day when one of the major hospital systems was not online. So realistically, we're at the lowest ventilator use that we've ever had. And then the ICU beds, this is still doing a downward trajectory. Now, those are all basically lagging indicators, every one of these. So now we're going to look at the leading indicator, which is the emergency room department visits. And you can see this one has been a little slower on its downward descent, but we have seen a few days where it broke under 900. We're back above 900 today. But again, this is a little noisier, so we're going to be watching this for a couple days to see what this does. Because if things start to change in the community, it's going to be here where we see it first.
And if ASU is driving these things, then one would assume that a lot of these cases are college-age kids who probably wouldn't need to be hospitalized, wouldn't need to go to the emergency room, might not even have symptoms. They just need to stay put because they've tested positive and that sort of thing. So we wouldn't necessarily see that in hospital numbers. But I guess the concern is that once it hits ASU, then it starts to spread into the surrounding community, especially if people don't know they're positive. And I think that if you track ASU right now, we're looking at about 1,000 tests that they're doing every day. They have 75,000 students on campus. They just came out with new numbers, although the numbers are sort of incomplete right now because as of September, well, it's updated September 3rd, but the number is actually from August 31st. And that's just one day. Their previous update gave us August 30th and gave us at least a couple of days of data. We are now just looking at one day, so they're still a couple of days behind on data, but their August 31st total for new cases was 174. So tough to tell whether that means that they're really trending up or what. We know that ASU has taken some additional steps. They've taken some of these students who are testing positive, tried to move them to different buildings, try to keep them isolated. And that actually goes along with what the CDC has recommended. Dr. Anthony Fauci said, you shouldn't send those kids home because if you send them home, that is a better way to spread the disease. You should try to keep them isolated on campus if you get that. But as we speak, I know Dr. Crow is at least talking with students and holding a forum about exactly where they are and what might precipitate scaling back or moving more classes to online or that sort of thing. But the zip code, Garrett, tells an interesting story at ASU, doesn't it?
It does. I was going to pull it up a certain way, but it's fighting me. So I'm going to pull it up on my Twitter account. And let me show you what this zip code looks like. This is, wow, that's, okay, there we go. This is 85281, which is the zip code of ASU. And what I did was basically I took Tempe. The city of Tempe actually collects and archives all the zip code data for the state, which is a great service that they provide for us. And basically we can look at the changes by day, and I aggregated them, summed them up by week. And you can see right here, 85281, you can see the peak of the pandemic. This matches what we saw, where it's June, early July, where the most cases occurred then. But then it starts down following our trajectories. And then here we are on 822, and it just shoots up to nearly double what it was on the peak of the pandemic. And that's only in the course of 1 week. So this is sort of the concern right now, is how much of this is isolated to ASU and how much of this has spread to the community, because this can be a concern, obviously, for not just Tempe, but as everyone who is in Arizona knows, Tempe is right smack dab into the middle of one of the largest sort of transit areas of Phoenix. Almost anybody who lives in the East Valley has to go through Tempe, and anybody who's going into Scottsdale from the West Valley or to the East Valley has to go through Tempe as well. So it's pretty much a cross section of the valley right there in the middle.
And when we look at ASU and we look at when we look at this particular age group and this demographic as well,
Yes.
the younger demographics are really starting to show the greatest increases in numbers of cases.
Yes, absolutely. Today, in fact, was pretty much the most, the largest number that I've seen far. I've been saying this for a while, in that this under 20 has been sort of growing at a slightly higher tick than the other age groups today. But today it was pretty significant. Today, 1.2% age growth in the under 20, and that's throughout the entire pandemic. That 1.2%. So they actually had that over 1% growth today. The other age groups didn't go higher than a half a point. So 20 to 44 only went a half a point. 65 plus only went a half a point. But that under 20 age group, it grew by leaps and bounds. Now, it is still the lowest per capita age group in the state that is impacted. And I'll show you that graph really quick. It's, like I said, there's a lot of room there for things to change here. Here, it is right there. I almost forgot it wasn't a browser window. And you can see that the under 20 age group is right here. But you're starting to see, if you really look close enough, and I can't zoom this in, so I apologize, but you can see that this is starting to, this under 20, which is this graph, it's starting to make a turn that the others really aren't making. So just today was such a large day that it's sort of creating a new bend in their curve that doesn't show up in the other curves. So we're going to be watching this very closely over the next several weeks, several days really, first, to see what this under 20 looks like. You know, especially when we get, this is a holiday weekend, so reportings will be very, very low. We're going to be waiting really till Wednesday to see, you know, how this is going to impact them.
It certainly sounds like what people do this weekend is one of the biggest causes of concern for people right now. We all remember the end of May and then Memorial Day weekend. People were opening up and people were starting to gather in all kinds of places. Next thing you knew, we had 2 weeks of a big spike in cases and really had to take some steps back in June. I want to get to some of the benchmarks because it's Thursday. The state and county kind of update their benchmarks as to where we are in terms of opening schools for in-person or a hybrid learning model, as well as businesses out there and how the benchmarks generally affect them. What are we seeing in that? It looks like we're seeing a pretty positive story overall.
Yeah, we're seeing a lot of movement in the benchmarks right now. I mean, as of right now, 90% of Arizona's population resides in a county that is within the moderate to minimal category at this point. So I'll share today's, this is what the ECDHS put out today as far as the county benchmark for the schools. And because that's the one that most people are most interested in. You can see right here, Apache and Yavapai, we already knew that they had made the benchmarks last week, but now they're joined by Cochise, Coconino, Greenlee, La Paz, which are both in the minimal, by the way. They're the first counties to both hit the green category. Maricopa County, Navajo, Pima, Pinal, and Yavapai. So all of those counties, the only counties left essentially that do not make the benchmarks are Gila, Graham, Mojave, and it does make the moderate benchmarks for business, just not for schools, and then Yuma.
And so when we look at these, it's important to know these are benchmarks for hybrid learning, which is, you know, it's a little bit different than the full-on in-person learning. And the state guidelines say that you got to drop below 5% for that percent positivity, which is apparently the hardest number to reach, because a lot of these counties they're green in 2 categories, but they haven't hit that 5% yet for a guideline. And bearing in mind, it's just a guideline. School districts don't necessarily have to follow it. We've already seen some districts open up to full-time in-person learning without necessarily meeting that number. Any way to project, though, when we get to 5%, when we're really seeing, especially in Maricopa County, for instance, that 5% number that the state says this is the benchmark you need to meet to go to full-time in-person learning?
Yes, we can actually look at that and see what we're going, essentially what we're probably going to be at for the next month, right now, or next week, excuse me. We're on the I think right now it's August 16th is the most recent week that they are calculating. Just want to make sure. Yes, August 16th. And so what we can do is we can just simply go to the AZDHS's dashboard. at the percent positives, and we can sort of look to see what the percent positive looks like for, say, Maricopa County for the next week. So right now we can see August 16th, we have a 5% positive. And we can see we have another 5% positive for next week. So technically, in this respect, it looks like Maricopa County will be within the 5% range, although I don't know if it makes it for the per capita. It does not. So it would not be considered minimal. It would have under, as you can, it'd be under a 5% or at 5% for percent positive. But Maricopa has quite a ways to go until it gets the case numbers, the per capita number down to where it should be.
And we talk about all of this, especially because we're seeing more and more school districts now announcing that they're going to start. For instance, Chandler last night, late night meeting, voted to start elementary students on a staggered schedule. So in Chandler, it's going to be kindergarten through second grade. They're going to start on September 14th, third through sixth grade. Then they're going to start on September 21st, and then they're planning a full-time in-person for all K through 12, basically, on October 13th, which is essentially the beginning of the second quarter after the fall break in Chandler. They're not the only ones. Gilbert is doing a similar model. They're starting in mid-September. I know we've seen, I think it's Dysart and Peoria also starting in mid-September with some form of either a staggered start or a hybrid learning or something like that. And so we're watching all of these numbers closely. Important to note, though, that these schools have also said that if the numbers change for them and if the metrics change, they don't continue on a downward trend or continue below those benchmarks, then they're going to have to reconsider some of those different things. Another indicator that I wanted to talk about a little bit, because we've seen this change over the last couple of days too, is the R-naught indicator. Arizona's been in a pretty good category here for a while. In fact, I think we were best in the nation as soon as a couple of weeks ago. We've now dropped back a little bit, but we're still in the green category. You want that R-naught number?
The green. Yeah, I've got it shared and ready to go. We are still in the green, but definitely these last couple days of case growth and percent positives that we've been talking about has definitely impacted our number. You can see right here, right now we're at a 0.95 with a range of 0.71 to 1.1. So we're well over the 1 mark at this point as far as the error bars go. So it presumes, for anybody who's joining us now, is that this estimate means that if 100 people have COVID-19, that this estimate thinks that for the most part, those 100 people would be able to pass the virus on to 95 people. And those error bars, of course, means that they'd be able to pass it on from anywhere from 71 people to 111 people. And obviously you can tell right there, that means it's either shrinking or growing. That's sort of where we are right now with the RT. And
a few weeks ago, that number was lower. It was in the 80 range, or 80 to 90 range. Just last week, it was not only were we the best in the nation, but our not was well under 1. It was, I think the error bar was all the way up to only like 0.95. So we were fully under 1. And then today, after we took a beating with those 2 case numbers, this is again driven by SEIOR. We've seen these increases. When we look at that, by the way, folks, if you have questions, please send them our way, especially if you want to know what's happening in your zip code. We're going to try to get to that. We've got some pretty good handles on some of the zip codes in different places. Garrett, we did speak off camera before we came on live here about Queen Creek. There's a lot of folks chatting about Queen Creek because Queen Creek was one of the earliest schools to go back to an in-person learning model on August 17th. So we've had a couple of weeks now to really see whether Queen Creek is really spiking cases in that particular zip code. And I know you looked it up a little bit earlier. It doesn't appear that they are. It does not. It does not appear that their particular zip code has seen a 15 case growth in the last week, which is very much within sort of the range of what we'd expect at this point. So it's not spiking what we're seeing in ASU, which is seeing larger growth than it ever has since the very beginning. Yeah, we're seeing I know that we've had some, anecdotally, there was a letter that went out to parents at Eastmark High School in Queen Creek a little bit earlier this week, notifying at least some of them that they may have been exposed. So they obviously had a positive case there on campus. It's important to note that a lot of these school districts are not required to report the numbers, that report their positive cases publicly. They don't have to make an announcement. They are required to report them to the county, and then the state, I assume, extrapolates some of that data as well. But we're still not seeing those numbers. It's a number I think a lot of parents would like to see. But if you go to the data dashboard, if you go to the county's website, you're not going to see numbers for schools.
The best thing we have is the Maricopa County GIS dashboard for schools, and I've got it pulled up. And this is only Maricopa County, people, so I can't do anything if it's outside the county. Oh, and I don't have it shared. I'm so sorry. I should probably have it shared before I say that I have it shared. And this is what we're looking at for this is the unified school districts in Maricopa County. As you can see, there's only one unified district now. And this is recalculated today, everybody. They did it early normal. So, we usually say that we can't do this until Friday, but we got a treat today. We can do all this today. So Saddle Mountain Unified is the only unified school district that is within the substantial category. The rest of the unified school districts are all within the yellow category. Some of them are still sort of in that orange category, like Mesa, for example. Mesa is still considered orange for another week, and a couple of these others. But we're starting to see some breakouts. We've also seen a lot more of these elementary school districts are starting to turn yellow as well. If you remember last week, all of these right here were red. We did have a little bit of yellow right here, but all of these were red. But now we're starting to get some yellow here. In the Roosevelt, in the Madison, and Washington elementary school districts are now all they're still in the orange category. They're in the moderate, but they still are considered virtual until they get 7%. And that seems to be Madison School District seems to be in the hybrid. So it's Osborne. And I think, no, that one's not in there. And then what else? We have the high school districts, and you can see Phoenix is still considered substantial even though it's yellow, it's still considered substantial for the purposes of schools. And that's going to be at least, possibly one more week. We don't know what's going to happen now because of what's happening with ASU, that if that's going to change. But right now it looks like it's going to be at least 1 week. And then let's see. I did the unifieds already? That's Paradise Valley. It's still in minimal. I will go to the cities just to show everybody what the cities look like. Essentially, at this point, Phoenix is now considered moderate. There's only a few small places in the valley that have substantial growth. El Mirage still is considered substantial, and so is Tolleson. Everywhere else essentially is considered. And this little tiny area of Carefree, probably because there's very few people that live there. We're starting to see a lot. Obviously, this is a lot more yellow than what it was yesterday. And then we'll go to zip codes, and we'll go through these a little bit. We have our first minimal zip code that's within the bounds of Maricopa County, and it's actually Sun City. It's 85375 is the first zip code to achieve minimal status.
We had a question earlier about Paradise Valley. Somebody wanted to know what was going on in Paradise Valley School District there.
Paradise Valley, I believe it's a unified. Yes. Paradise Valley School District. It looks like for the most part, it is already, so it's within the hybrid learning model at this point. It's not within it made it 7%. So it's fully in hybrid. It actually looks like it's on the way to being, it might even make minimal in about 3 or 4 weeks, but it's going to take a little bit of time. It's at 28.29, especially with the cases, the way they're slowing down, the decreases are slowing down. It might take a couple of weeks for that to get into the minimal.
We had a question earlier as well from somebody. Why doesn't the state or why doesn't the county have to report to the public? We have to extrapolate the data based on zip code. Yeah, that's the way we have to do it right now. We should say that we have been pressing the county and the state and asking why we can't get that particular data because, Garrett, correct me if I'm wrong, the way the state has set this up, school districts do have to track their cases, and they do have to report those to the county. So the data is there. They're collecting the data. They're
Yes.
just not releasing this particular data. And the governor says we're not hiding the data. But the fact is that they have the data, and it's not being put out to the public, at least not by school district. It's only being put out at this point by zip code.
Yeah, well, we do have, I said, we don't have, we have these case numbers and this data, which is 2 weeks. It follows the gating criteria. So we're looking at data that's from about 12 days ago, which I know sort of drives people crazy, but that's the best we have. And this is the best thing we have as far as we've got per capita numbers, which we could take, we could simply use these per capita. You know, we get these numbers. We can figure out what the per capita, using that per capita number, we can figure out what the population is and then figure out what the cases per people. But again, like you just said, I don't know if these are schools themselves. We don't know how many of these are school children. All we know is this is what the case numbers look like in the jurisdiction of the Unified School District. But we have no idea how many of these are from, say, Paradise Valley High School. They do have that data. Go ahead, sorry.
We have a number of folks asking about particular zip codes. I don't know if you can look some of these up. 85345. Not sure where that is.
It seems to be Peoria, 85345. Yes, it is considered substantial, but it appears that it is from last week that it's considered substantial, so it should revert to moderate by next week, as long as trajectories don't change too drastically over the next couple of weeks, because they are changing right now. We just don't know how badly they're going to change. So I don't have an 85138. Sorry. 5297. We'll try 85297. That is a moderate zip code. Let's see. 85041. There we go. 85041 is still considered substantial. This is, but it looks like it's from, again, last week. So because it's from last week, it should revert to yellow by next Thursday. And see what else we got here. 85254. This is a moderate zip code. 8027. I don't have 75098. Sorry. And I think, what else we got? One more. All right. 85051. And 85051 is right here. And this one does also appear to be, it should revert to yellow next week as well, just because all of these numbers look good here. So you can see a lot of these zip codes are starting to turn. We only have a few. I just clicked on one right here, 85043, that still has a percent positivity over 10%. There's one right here, 13% right here. So some South Phoenix zip codes, but not that many of them, are still showing substantial 14% right here at 85035, 19% at 85033. So that's pretty significant. And then 20%, wow, 20% at 85031. So you can see, obviously, there's still some zip codes that have some tremendous percent positives, and they have a while to go. But many of these zip codes, especially the ones that are more on the outskirts and are more congruent and intersecting with these yellow zip codes, they seem to be moving into that direction and should be flipped to yellow sooner than later.
Can we talk about the lag a little bit? Because we were talking a little bit about this off camera, and that when we start to look at if schools are going to spike cases in their particular communities, and that ASU is in that category as well, we won't really know for a couple of weeks how much it affects the trends overall, right?
Yeah, that is the concern as far as their dashboard. So what they do is you can see the data two ways. So we can see county data going all the way up to real time. It's not complete, but we can still see it. So we can see. So for example, if things start to change in Yuma, for example, even though the business dashboard or the school dashboard will say August 16th, we'll be able to tell earlier than that if things are changing. We can say, well, we have data from September 3rd saying that case growth is going up, so we know that Yuma is going to move from moderate to substantial, for example. But like you said, we don't have that data for anything under county. So if, for example, 85281, which I'll go back to it really quick, even though we've just spent a lot of time on the zip code map. I'll just stick on 85281 because I think it's an important story to tell here. 85281, this is Tempe. This is ASU. You can see, if you look at these numbers right here, you would say, wow, under 100K, under 100 per 100K, and it has a percent positivity of 3%. I mean, these are great numbers, but they also just added 600 cases this week. And that is, well, I can tell you just based on that number, that is well over 100 per 100K. So even though this particular zip code is as of this moment, it should be considered red, we will not see it as red for at least 2 weeks because of the way that this works. So we won't see it until it looks like the September 17th is when we will see it flip to red, even though it's already basically has red in it at this point.
That's a big cause for concern because, as we know, you have to act fast if you're going to start doing more mitigating measures or that sort of thing, right? I mean, you have to move pretty quickly in these things, and if your data is a week old or 2 weeks old, and it makes it a little bit more difficult. I do have one question here from Debbie Kirkpatrick. She asked, Garrett, does ASU differentiate between the different campuses, their main campus, West, Polytechnic? We talked about this a little bit yesterday, but most of the cases are in Tempe, right?
Almost all of them are in Tempe. All we can do is check on the zip codes themselves, and because ASU itself does not differentiate between any of the campuses at this point. I have heard through the grapevine that they're wanting to do a dashboard, or they're looking to do a dashboard, but it's in development right now. I don't know the validity to that, but that's what I've heard. But almost all the cases are, I mean, we're talking like 90% of the cases are from ASU Tempe.
And a reminder, we've just posted on the comments section a link to how you can check your own school district, city, or zip code in the Maricopa County dashboard. Go to that comment and go to our school metrics section. Really, we put together quite a database on the school metrics section, and all of us on the education team have been pretty active just trying to make sure that the reopening plans and all of that are current, because we're seeing a lot of them change. I mentioned Chandler earlier. Originally, Chandler was going to push everything back to October 13th. Last night, they modified that plan a little bit, rejecting a hybrid plan, basically going to a staggered plan in mid-September, and then September 21st as well. One of the things that everybody always wants to know, that probably the biggest question I get is about, well, what happens next? What's the future? That sort of thing. And I guess, Garrett, the best clue we have for that is the modeling that gets done on Arizona and what it shows and what. And first of all, I think we should probably explain how they do the modeling. The modeling is only reflective of the most recent data, and the modeling can change pretty significantly if the data changes even day to day. So when we start to look at different models and we start to look at the possibility of maybe a second spike or a second wave, maybe in the fall or late winter, keep in mind that's based on the most current data that we have. But anybody that watches these models knows that they can change pretty significantly day to day, can't they?
Yes, they can, especially the models that are what's called the SEIOR model, the SEIR models. These are the sort of the epidemiological models that are also trying to figure out the difference between mitigations, strategies, easing social distancing, as well as mask use, and things like just general mobility in the state. So they try to make a lot more guesses based on that information. And of course, the most famous of those is the University of Washington model, which I have pulled up. And this one, basically, you can sort of see what it's talking about, what you're talking about as far as infections based on what could happen in the near future here. So you can see what this is saying as we get past today, and you can see this divergent in the curve. What this is saying that if we continued with mask mandates, universal mask mandates, it would go down. In what it believes as far as mandates are easing, if mandates continue to ease, then we would start to see a daily infection increase. And you can see where they're split now. Now, they're not as split as aggressively as they used to. I remember back in June and July, you would see these massive differences between the mask mask use, mobility, as well as just having nothing. And we're not seeing that as much anymore. We're seeing much more reasonable distances between the two.
And the modeling shows the hospitals don't get overwhelmed. That's a
Yeah.
good sign as well.
Yes.
But it appears to show, a little bit of an uptick in going back in, when we start to get in November and December, which is a bit of a concern. I'm curious, and maybe it's a really complicated explanation, but when you look at this model, it's initially projecting a downward trend, but at some point it's projecting we bottom out and go back up. How does that come about? When
I think what I think that is I think that's a tune. When I've talked to a couple people on this, and I think what that is that might be a situation in which they are using a mathematical formula to assume for most of the country in the wintertime, people spend more time indoors. So, even though we're sort of opposite here in Arizona, we spend a lot more time outdoors. Most of the country does the opposite. So this curve we're looking right now could be a product of what they're presuming is going to happen with the majority of the rest of the country, and not particularly in Arizona. But we're such a small part of the country; they're not going to develop a model specifically for Arizona's weather patterns. So that's sort of what I think might be going on here. Is we're seeing them saying, "Oh, well, it's wintertime, so everyone's going to start being indoors more." But that just might not be the same for us. That's sort of my own really concern, or just guess onto why that could be increasing the way it is.
Yeah, and of course the interesting thing is they start showing our cases going up about the time when people start going outside in Arizona.
Yes.
We get to October, hopefully earlier than that in September, we start to get some nice weather and more people kind of go outside, which is a good thing in terms of spreading coronavirus, because you're less likely to spread it than you are indoors. Mm-hmm. I want to get to one other question here, and I know this is sort of random, but Carrie Bearmore writes, how many of ASU's cases are from out-of-state students? We don't know that necessarily, out-of-state students, but we do know ASU has talked about the number of off-campus versus on-campus students, which is an indicator, something we need to be concerned about, because ASU can't really control the off-campus students. They can tell them to isolate and all of that, but they can't move them to dorms and isolate those dorms and that sort of thing. And most of the cases at ASU have been people who live off campus. Correct?
Yes. Most of the cases have been from off campus, yes.
Because I think it's, I forget what the numbers are, but 75,000 kids overall at all three of ASU's campuses, most of them in Tempe. And I think it's somewhere in the neighborhood of 10,000 kids live actually on campus in Tempe. So it would stand to reason that if most of the kids that go to school there are from off campus, you'd have most of your cases from off campus. But that's but we don't know how many of them are coming from.
And of course, it would be the rest of those cases. I mean, we all know, we've been here, most of us have been in Arizona for quite some time now. We know that, ASU students literally come from all over the valley. And so any of the other cases could certainly, they're just being sort of, they're propagating into the rest of the zip codes. And so it would be very difficult to sort of see a noticeable uptick, even with them saying, oh, so many of these kids are from outside the zip code. I mean, they could be from anywhere. They could be from Scottsdale. They could be from Peoria. They could be from Guadalupe. They could be from anywhere. So because of that, it would be very difficult to sort of detect increases at like we do at ASU, where we know that there's kids in dorms and we're saying, wow, there's 600 more cases last week. We wouldn't see that in the other zip codes until, everything starts. If again, this is if things start moving up, then we would sort of see everything moving up together.
Yeah, and the question may be getting at, how many of it's trying to quantify how many of these kids may be coming in from out of state and bringing the virus here. Yeah. That's very difficult because we don't know when these kids arrived. I mean, there are kids who may be from out of state, but they may have spent the summer here. There are obviously some kids that probably just arrived. There are undoubtedly some international students who can't afford to go home for a couple of months and come back, and especially if you live overseas or something like that. So it's difficult to really say whether these kids are bringing it in from out of state or or that sort of thing.
And sort of the silver lining I've seen, at least, is that, if you can find silver lining in something like this, is what I've read is that, if you're of this age group, this college age group, your infectious period is very low, usually under 7 days. And in many ways, in many situations, because of the way that the PCR tests work, we could be testing. There could be a good portion of people that are testing positive. I do not know the number of this, but there could be a certain percentage of kids that are testing positive that are already on the back end of their infection, and they're no longer infectious. In fact, they probably barely knew they were infectious, and they're just the PCR test is picking up traces of the virus and considering it a positive. That is a possibility. Although, again, I do not know how many that would entail.
Donna Martins writes, how about a business update? We have benchmarks for schools, and we have benchmarks for businesses as well.
Let's do the businesses really quick. Let me get to that really quick, and then we can. Sorry, I didn't have it pulled up. I was really bad about that. Let me get to it. So essentially, the business dashboard obviously in many ways reflects the school dashboard. The only real difference is the 7% threshold for schools. But we'll look at this really quick. Most of these, as we've talked about before, La Paz, let's see, hold on what that was. Sorry about that. Greenlee, minimal. La Paz joins Greenlee in minimal status. Those are the two we talked about. Maricopa still retains its moderate status. Pinal, what moved into moderate, that was the one that sort of stuck out last time, and they moved into moderate. Mojave County, I was talking about this yesterday, how Mojave County, as you can see, hair on the line. They're literally walking the line at that 10%. And I guess the tie goes to the winner in this case, because they were given the moderate status, even though they were at 10%. So I guess it's tie goes to the winner there. So, and then the other counties that we have different for is, it looks like, Pima's fine. Santa Cruz, I believe, moved to moderate today. It did. Santa Cruz is now in the moderate category. Essentially, everyone, 90% of the population is now in the moderate. All we're looking at now is Graham, Gila, Yuma, and I believe that is it. Graham, Gila, and Yuma are the only ones left that are not considered substantial or are not moderate at this point.
And so that means that these businesses can continue to stay open with some obvious safety protocols, and you'll still have to wear masks inside. I think the restaurants are still going to have to be at about 50% capacity, that sort of thing, but they can stay open and at least continue to generate some revenue. And I think if, clearly the governor's office and the state have made it pretty clear that they're taking the enforcement of this pretty seriously. They shut down a couple of Scottsdale bars last weekend. A couple of, I think 1 or 2 bars in Tempe as well got shut down for not following the rules. And so when a lot of these businesses realize that they're not messing around here, I think a lot of them are following the rules and paying attention. As long as people follow the rules as well, we'll be in pretty good shape. We had a question earlier, do we have to wear masks forever? It's not really a data question, I guess. But
it's not.
but at the same time, we can probably look at, when most of the counties went to mask mandates, we can clearly say that certainly helped to bring our numbers down.
It's definitely within the time frame where if it was significant, it would have been significant.
And so will we have to wear masks forever? I think the big question there is probably the vaccine question, which is when we're going to get a vaccine and when we're actually going to be able to achieve that herd immunity by getting people vaccinated and getting people with antibodies in their systems. And so will we have to wear them forever? I certainly hope not. And I really doubt that we will. But I think it's reasonable to assume that we'll probably have to wear them at least for a period of time until we can get a vaccine actually out there and distributed and available for people and that sort of thing. So other things to wrap up, I guess, is group risk assessment. Do we want to talk about that a little bit?
We don't have to go over that today. We can go over. I think we're running out of time here, so I didn't want to get us too far over the 45-minute mark.
No, well, certainly not. But so I guess to wrap up, in general, pretty good story across most of the state. We have seen these numbers tick down, but when we start to look at maybe some of the upticks that we're seeing, a lot of that, if not nearly all of that, is attributed to what we're seeing happening at ASU right now.
The good thing right now is that the test we have is so much more faster than it was in June and July that if something is to occur, we're going to pick it up a lot faster than we did. So that's the good thing. That's the hope, is that we'll have that, and it'll just be much better because of that.
Great. Garrett, thanks as always for checking in with us. I appreciate it, and your interpretation of the numbers. I always learn something every time that I host this. I know you're going to be off tomorrow and off on Monday as well, so there will be no analysis of the numbers there. Generally, you would expect, though, that there's going to be kind of a lag of reporting like there usually is over the weekend.
Yeah,
anyway,
tomorrow might be interesting, but Monday is going to be very low. Yes.
Yeah. So once again, we appreciate all of your questions here. Looks like we've got a pretty good story in general to tell in Arizona as we look to more and more K through 12 schools opening up. The biggest question mark we have right now is what's happening on ASU's Tempe campus. Once again, thanks for everybody for joining us, and thanks for all of your great questions as well. We'll see you again soon, and we'll see you on the news coming up at 5.